The obstetric song. What is the obstetric song? It simply means clerking normal pregnancy. Everybody doing 1G posting is supposed to know how to clerk normal pregnancy. It's a must know because 70% of people during their long cases will see normal pregnancy. So it's a must know. It's unforgivable if you don't know the obstetric song. That is clerking normal pregnancy. So let's go. Let's discuss on this. This is the obstetric song. First of all, you simply start. My patient is Miss A.S., a booked 28-year-old Gravida 2 para 1 plus 0 businesswoman with one living child who is a female. She resides at number 15 Ojo Street, Ekuma. She is Asa and Christian with a tertiary level of education. Her last menstrual period is on the 10th of July 2024, which placed her expected date of delivery on the dash dash 2025 and her estimated gestational age at 27 or 28 weeks and 1 day today. That you calculate depending on the patient. She presented for her routine antenatal clinic visits. She feels good fetal movements. She have no complaint. Index pregnancy was desired and spontaneously conceived. It was booked at this facility at 12-week gestation. At booking, she have no complaint. Her booking weight was 70 kg and her height is 1.7 meters. At booking, blood pressure and urinalysis were done and were said to be normal. Her PCV at booking was 33%. At booking, malaria parasite test was done and was negative. Hepatitis B serological screening for hepatitis B surface antigen and anti-hepatitis C with Venereal Disease Research Laboratory were done and were not reactive. Her retroviral status is negative. Urine microscopy culture and sensitivity was done at booking and yielded no growths after 24 hours of incubation. At booking, ultrasound scan was done, which shows a singleton fetus with normal cardiac and fetal activities, and placed her expected date of delivery at on the dash dash 2025. She has been compliant with her routine antenatal visits and has been compliant with her routine antenatal medications. She has had a total of 8 clinic visits. In each of these visits, her symphysiofundal height was checked and her blood pressure was checked and we are said to be normal. Next, she had had 2 doses of tetanus toxoid prophylaxis at 20th and 24 weeks gestation and I have 2 doses of intermittent preventive treatments for malaria at 28 or maybe 24 and 28 weeks of gestation, depending on what she tells you. 24 and 28 weeks gestation. Pregnancy has been uneventful. Her last confinement was 3 years ago. Pregnancy was desired and spontaneously conceived. It was booked at this facility as 16-week gestation. There was no history of fever or rash during pregnancy. She delivered at 10 or at 38 weeks or at 37 weeks of a live male neonate who cried well at birth. Baby is well and is immunized for age. She attained menarche at 15 years of age. She normally menstruates for 3 to 5 days in a 28 to 30-day cycle with no associated dysmenorrhea or menorrhagia. She is well aware of contraceptives and occasionally use a male condom. She is not aware of pap smell and has been counselled on the need to have one done. She has not previously been admitted in the past, nor has she had a previous blood transfusion. She is not on any known medication and is not allergic to any. She is married in a monogamous setting to a 38-year-old lawyer with tertiary level of education. There is family history of twinning. There's no family history of hypertension, epilepsy, diabetes, or sickle cell disease. There's no history of headache. There's no blindness of eyes. There's no neck pain, no chest pain, no chest tightness, no diarrhea, no constipation, no muscle pain, and all of that. Any other review of system. In summary, I've presented a 28-year-old booked gravida 2 para 1 plus 0 business woman, or 28-year-old, which is you should know her business, who presented for her routine antenatal clinic visits. She had no complaint, and that's all. That's all. The little changes you may make in this is: one, if the blood group is O negative, you should mention the blood group of her husband. You get? If she is AS and the genotype is AS, you should mention the genotype of the husband. This is to know if the child is at risk of versus isoimmunization and sickle cell anemia. You get? So that's that for that. So that's the obstetric song, the must know.